The surgery that we see in the summertime is a combination of small elective cases as well as long elective cases. So on the shorter side, these are cases that can wait till the end of the school period so that their academics aren't disrupted. And for general surgery, that would include hernia repairs. For ENT, that would also include tonsils and adenoids being removed. And then there's a slew of big operations that aren't emergencies per se, but can wait till the end of the school year. For orthopedics, this includes major spinal surgery for scoliosis. In general surgery, we do major chest wall repairs for the conditions of pectus excavatum. And for urology, it also includes bladder reconstruction. So these are cases that can wait, but require a long period of time to recover, and so the summer is the perfect time to do that. It's just convenient for families, it's convenient for the kids, you don't want their academics to be disrupted. We try to get these cases done so they can focus the rest of their summer on recovering as opposed to that happening during the school year. Unfortunately, the summertime means increased activity, and it also means an increase in trauma. And so there's a lot of things that we'd like to emphasize on trauma, particularly prevention of that happening. We see a lot of fractures of bones, and the orthopedics team is very busy with this over the summer, repairing the elbow fractures and leg fractures that come with that. Unfortunately, we see a lot of other types of trauma as well, drownings, head injuries, falls, and so I think the main aspect that we would like to emphasize is parental supervision in any of these activities. For children, riding bikes, and I would highly recommend wearing a helmet. We see so many head injuries that require operative and non-operative management, and this is something that's completely preventable. And, you know, as far as sports and whatnot, taking the proper precautions and wearing the appropriate padding is the best that we can do, although we do know that even still there will be some injuries to take care of. You know, the ATVs are a major source of injury, and we see kids who are non-helmeted riding that. And first of all, they're too young to be riding it. I mean, in general, in some states, it's the age of 16 as a minimum to ride ATVs. And in other states, it's 12. But we're seeing 2-year-olds, we're seeing 4-year-olds, we're seeing 9-year-olds come in with major head injuries, with major head bleeds and brain bleeds requiring emergent neurosurgery. And so, you know, the use of ATVs is certainly a controversial one, but at the very least a helmet should be worn in those situations. And so I think whether you're riding your bike or whether you're riding a scooter, it's important to wear a helmet and to protect that head. Our institution ranks among the highest as far as cases performed every year in the country. We are typically 1, 2, or 3 as far as the number of cases we do, and so that puts into context how busy we are and how safe our programs are here. Now, if we're doing well over 23,000 cases a year at Texas Children's Hospital, that means our anesthesiologists are doing that many anesthetics, and therefore they are truly among the most talented and busy groups in the country. Not only are these many surgical procedures are being done, but you know, all these patients require radiologic care. They require the services of so many different subspecialists that make this the ideal place to have your child have a surgical procedure. And so, from the child life aspect to physical therapist, occupational therapists, and the nursing care. All of them are just totally geared and focused on taking care of children, and they do it very well. So within the Texas Children's operating room enterprise, that also includes the West Campus effort. And these are the same anesthesiologists, the same nurses, and the same surgeons who are providing this care out there. And so we are doing a lot of elective surgery, not too complex, but there's a whole orthopedic sports surgery medicine going out there. That's being led by Dr. May and Dr. McKay out there. But we're doing a lot of both urgent and elective surgery out there. And so that's a terrific place for those who want to beat the traffic in the medical center. Parents have a lot of choices in where they can have their operation performed. That doesn't always mean it's the best or the safest for their children. At our institution, we are blessed with having over 50 anesthesiologists who are specially certified and trained in pediatric anesthesia care. Not only that, all of our surgical specialists are TCH surgeons who just provide pediatric care. And when you have people who take care of children day in and day out, that's what they're good at. They take care of children. When you start to when you have pediatric care delivered at hospitals that mix with adult care, you don't have that expertise per se, and you don't necessarily have anesthesiologists who are trained to take care of children. And that's where you may miss some of that expertise. When it comes to injuries, we think trauma during the summer, and far and away, it's orthopedics who have to take care of all those fractures. Some of them are severe enough where they have to be admitted, have to have emergency surgery, and some of them can be splinted, casted, and sent home for follow-up in the office. But they far and away are the highest number of traumas. We see a lot of neurosurgical injuries as well due to not wearing a helmet and car accidents, and those children are taken care of by our neurosurgical team. And then our own pediatric surgical team take care of a lot of blunt and penetrating trauma as well during the summer. Most of those fortunately do not need a surgical procedure, but we're prepared 24/7 if that's necessary. Foreign bodies are actually one of the most common emergent procedures that we do, both in the airway and the esophagus. And every once in a while, it'll make its way down into the intestine, and we have to be a little more invasive and creative in how we get those things out. So we certainly do see a lot of those. Well, our Level 1 Trauma Center is now 3 to 4 years old, and we are prepared to handle pretty much any and all injuries that can occur to children. In the summers, we definitely see an increase in traumas. The kids are out of school or out of daycare, and they're home, and they're just getting into trouble. And it's the homes where a lot of these children can have accidents. And some of the most common accidents that we see in the summer include drownings. This can happen as low as 2 to 3 inches of water in a bathtub, not to mention the swimming pool in the backyard. We recommend that parents always keep an eye on their children. Don't let an older sibling supervise a younger sibling. And if you're going to have a swimming pool, we highly recommend having a fence around that swimming pool that's difficult to access for the toddlers. Even when parents turn their backs for a minute to take care of another child, that's just enough time for another little one to get in trouble. And so adult supervision is absolutely critical in preventing drownings. We also see a lot of falls, particularly with little babies. We recommend having gates both at the entrance and exits of stairwells to prevent these kind of injuries. And also having heavy objects pulled onto children. Children just have a way of climbing up furniture and pulling down heavy television sets on top of them, particularly the old television sets before these flat screens came along. And so that's another common injury that we see quite a bit during the summer. It can be absolutely devastating. While it can be difficult to keep an eye on your kid 24/7 around the clock, it is advisable to help prevent these type of injuries by having these type of appliances and furniture well stabilized and secured. Another cause of trauma that we see quite a bit is suffocation by infants. And how you prepare a crib is so critical for these infants, and that includes not having plush bedding, avoiding the use of crib bumpers, not having excessive toys inside of the crib as well. The children should be dressed in just a simple one-piece outfit without any blankets or pillows, because these can also suffocate the child. We also discourage co-sleeping with the children, because we have seen some infants who are suffocated by their parents inadvertently, and that's always very sad, and so we recommend not co-sleeping as well. In the summer, the kids are out playing, they're in the fields, they're in the yards, and with that there's going to be stings by ants, an occasional scorpion, bees, hornets, wasps. And so the main thing is conservative care. If you find that they are becoming redder and it's associated with a fever, we do definitely recommend you see your pediatrician to have it looked at, and perhaps the use of antibiotics will be needed. But otherwise, conservative care with, and perhaps a conservative care with Benadryl ointments or cortisone would be helpful in those situations. I think throughout the year we perform procedures that are very common to us. Some people would call them bread and butter cases that would include hernia repairs, circumcisions, tonsils and adenoids. The summers are particularly good for these type of procedures because it doesn't interfere with the kids' school year. When kids are out of school to recover and to have these procedures, it can be disruptive not only to their classroom but to them as well, and to the habits and the patterns that they've associated. So performing these types of procedures during the summer are a great way to not have the stresses and worries of missing homework in school, and to get those procedures done in a non-hurried fashion. And so one of the things that we will often see are potential poisoning opportunities. And these include the typical cleaning supplies that you may find underneath the sink. And so we highly recommend securing those type of cabinets, which will make it difficult, particularly for the toddlers to get into. Some of the more popular items now are those little soap packets for the washing machines. They also make them for the dishwasher now as well. And they're just the right side to jam into a little kid's mouth. Outside of that, kids being outside, they need to be careful about the little berries they pick off of the plants and whatnot. And so if you're concerned or any of these things have happened, we recommend you contacting and seeing your pediatrician as soon as possible. I think it's easy to fall into a habit during the summer. The kids are just running around. It almost becomes background noise. But during that time, we have to keep our sensors alert and on a high level, that at any time they could be doing something to hurt themselves. And this also includes finding a soap packet to eat. It includes finding that gun that wasn't locked away properly. It includes sneaking out the back door to play in the swimming pool by themselves. The summer's a perfect time because they're around, they're not in preschool, they're not in school, and they can quickly find themselves in trouble. And we highly recommend that parents be attuned to this and keep them in their sights. One of the things for a parent, if they find that their child is missing during the middle of the day and you have a swimming pool, our recommendation would be go and look at the swimming pool first. Anywhere else in the house, at least they are enclosed within the house, but it's a swimming pool. If they get into trouble, seconds can count, and you need to get there and make sure that they're not in trouble on the swimming pool first. At Texas Children's Hospital, we're blessed to have this level 1 trauma designation, but it's more than just having an empty room. It's about having nurses who are specifically trained for trauma. It's about surgeons being specifically trained for trauma. And when we talk about surgeons, we talk about general surgeons, we talk about orthopedic surgeons, neurosurgeons, ENT surgeons, who all have training and specialization in taking care of traumatic problems. And then we have the nurses, and we have child life, we have radiologists. These are all parts of what make our level 1 trauma centers so outstanding.